Hi, welcome to Life Meets Jayson. I'm Jayson. This is Patty.
Hi.
Patty is a nurse. Not just any nurse, she's a special nurse that we're going to talk to today about things that often affect us. So, tell me what you do.
I am a psychiatric nurse, and I help people when they feel that they're in a crisis. And I help them get through that, and a lot of times it's younger kids when it's their first...
Really? Younger kids?
Yeah.
Okay.
Of course I have like adolescents, so I'm seeing people that are 18, but that's typically when we see some of their psychosis starting and some diseases.
Right.
And so it's their first time and they don't know what's going on, and also kids are experimenting at that age, so they don't know.
Oh, drugs and all?
Yeah.
Does drugs have anything to do with mental health?
Well, some people, because they can't afford their medications, they use other substances to try to help with either voices or something they're dealing with, mania, and...
That makes sense.
Yeah.
Give me just a big picture. What are the categories and which ones do you specifically deal with?
Yes, the majority of what we see is going to be that people tend to see more of a psychotic break, where I'm seeing them acutely, is going to be schizophrenia, any schizoaffective disorder. So that's kind of where they're mixed with bipolar and schizophrenia.
Bipolar.
Yeah. We have a range of patients that are coming in that are young and in college, and then from older people that are CEOs. They tend to mask it by overworking themselves. But once they stabilize, because they're bipolar and they get everything done because of their mania. They're like, I have all this free time, what am I doing? Like, oh, I can't even sit still, and it becomes overwhelming, and they feel like paranoid. They become paranoid because of it, and so we see them kind of at that time. And people where it's their first time hearing voices and they're schizophrenic and they never knew it ran in their family.
Okay, I know I'm weird, but I always kind of thought it would be great to hear voices. Because in my head, I just thought to myself, what if it was like Mickey Mouse, like, hey pal, great job, like all the time. Wouldn't that be amazing?
Yeah.
But they're not like that, are they?
They're not.
Why are they never good?
Because they... Well, we don't know exactly, but we feel that a lot of it is kind of like our subconscious talking to them.
But why are all of our subconsciouses so messed up? Isn't there anybody out there who's like so bipolar that their subconscious is good and they just act crappy?
And some of them are. Some of them are like, go for it, you can do it. Let's
really?
do
Some
it.
of the voices?
Sometimes.
Okay.
But that gets them in jail sometimes.
But then they tell you, go ahead, do this horrible thing. Or, okay.
Like to you at the time, if you're manic and they're like, go up to 100 miles per hour, it's going to be fun. And then it's not fun. And so it just depends on the person, the experience, their environment, their support system. A lot of them don't have the support system. Substance use. Some people try to down the voices with alcohol or other substances.
I think I just dealt with food for the most part. Being depressed is a great way to not be manic. But on the other end of it, it's a great way to be depressed. Like, I did my whole honest video about being like fat, and I was like, okay, here it is. And then after I saw myself on camera, it did something. Like, I was like, oh, you know what? That's one side. Now I get to do the other. What am I going to do about it? And that was nice.
Yeah.
The approach that is taken at your facility, is it not making a YouTube video, but more therapy, or is it medication, or is it...
So
how do you know which one to do?
Unfortunately, the first probably 4 days that a patient is there, it's going to be medications, because they're either brought in by police or they're...
It's acute.
Yes. They're not listening to what, your therapist is saying or any of that information, so we have to get them into a level where they're like, okay, I see what you're saying, and I want to try that. If they're at that point, we provide the therapy, and then we can say, if you really don't want to take medications, or now we're at this opportunity and stage in psychiatric health where we can offer long-acting injections for some disorders, which is nice because it helps the population that unfortunately is homeless and they can't afford the medications. So like it allows them to be like, for at least a month I can be normal.
If you've got 50 million things that are challenging you, medication is going to be part of it if it's going to be effective. What types of things can be addressed reasonably effectively with talk therapy? The
first conversation we have with patients is going to be, why did you stop the medication, if they were on medication or if they've ever been prescribed medication. Maybe it was, my doctor wasn't listening to me, I didn't like the side effects, whatever it is, and that's a big issue. Some people were like, I gained so much weight when I got on this antidepressant. Or
what's that one? I'm not taking it. I forgot which one I was on. I've been very stable. It's mainly just Lamictal and bupropion. Just those two. A little happy and a little bit stable. Like that's, I'm type 2. Anyway, it made me suicidal. That is so strange. There's a chemical button you can push that makes you want to kill yourself. Is there a chemical button you can push that makes you want to make a souffle? Like, it is so specific. What is that trigger that we have?
Antidepressants have a thing where they're trying to either increase your serotonin, your dopamine, some aspect of that. Sometimes with medications that are prescribed for anxiety and depression, it's going to trigger multiple chemicals. Maybe you only need more serotonin, but the medication is giving you dopamine and serotonin.
But that makes you suicidal? It seems so specific.
Yeah.
That's weird.
It depends.
So when I was Googling about mental health, first of all, I'm getting nothing but ads for medication now. But I wanted to look at some real positive aspects of it, because there's this label, mental illness, and then it's like, that does something to a person where I have this label now. But there is a huge spectrum of, I would think, just traits. Having certain skills is actually really positive if they're used appropriately.
Yeah.
Like something with a lot of details, I'll think about 50 things like that. And that's great sometimes. What are some examples you've seen of that come in? If they're CEOs, what is that that's working for them?
So they're channeling their energy.
Okay.
So what they're doing is, like, when you're in a manic state, you're saying, okay, I have this energy, I can do a lot of things and probably do them all efficiently. What is the most efficient way I can do this? They probably list all 3 quickly within a minute or 2.
Right.
And then they're like, okay, makes the most sense, it's gonna happen. And then they tell someone, hey, this is what we're doing and and this is our deadline.
Right.
And so things get done and, it's efficient. So it's about channeling it and then how to deal with that energy.
A lot of people who have depression, they go into entertainment and they go in specifically to be comedians or writers. They make something wonderful out of their challenges.
Yeah. And I think we see that a lot. Like Carrie Fisher was very notorious for being very blunt.
Oh, you're right.
And she was bipolar. And she was just very blunt about it.
She's
oh, I know I'm crazy and I'm wild, but I'm successful. And
she did a one-woman show.
Yeah.
Did you see it?
Yeah.
It was
so
good.
I mean, that's why she was one of the people that are like, you can get past the stigma because you can be successful.
Right.
But like everyone, go to therapy, talk to your doctor.
Sure. I looked at online and I would say success stories, mental illness, and it was like,
I succeeded in living
semi-normally.
It's never I succeeded because of it. But then you look at artists, they're always amazing. A lot what's that dude that did the Sunday in the Park thing with all the little tiny pixels? There's some OCD going on. And he's a lot more stable, very logical. Poe, you're making noise. I know you're deaf and you can't hear it, but you're making noise. Okay, thank you. Don't move. Be like a statue. What about depression? What's good about that?
Depression. So we become better readers of other people. So a lot of the time we see that people who suffer from depression are usually in the fields that care for other people, such as nursing.
You know what? That would be really good. I can see that you're more compassionate.
Yeah.
It's interesting. I talk a lot about my own condition because it's just exciting to be able to talk about it with someone, especially who's being fat, for example, at the moment, being very, obviously obese, that is so much more visible than somebody who is depressed. Although those two particularly work very well together. But yeah, if someone's just OCD or whatever it is, they're walking around, you don't see what's inside their head. But you see the fact, I think there's a lot more shame about this only because it's so much more visible. So they're hiding it. They don't even get to talk about it. They don't even get to debate it in a society because it's hidden.
Yeah, and that's what we call generational stigma. So we see that in a lot of the cultures and growing up back in the day, oh, that guy talks to himself, he's crazy, don't get near him. Or you're sad, just rub dirt on it. You're not chronically depressed. Why? You have a perfect life. But the understanding that, there's a chemical imbalance or there was an environmental or a trauma that has started this, and that doesn't want to be talked about because then your parenting was bad.
So if I'd had a mom who was everyone in my family's, there's something going on, like you were saying, let me look at that, not be ashamed of it.
Yeah.
Maybe it would have been different. When I first took my medicine, I was 34, I think. my brain just wouldn't stop racing. I got diagnosed, I took my medicine, 80% of my problems went away.
It was in 4th grade where it was the school saying, you know, she's not interested in her singing choir anymore. She doesn't even like raise her hand. She used to be a very like charismatic, involved student. Now she's just sitting at her desk, always tired. Like, is there something going on at home? Of course, they're gonna ask you, is she sleeping? Is she eating? But it was always like that could never be my kid type of situation.
Was that some kind of depression? Is it okay to ask?
So yeah, I was diagnosed with depression, and my mom refused to think that I needed medication for it. So I didn't get treated until I was in 6th grade. I knew that she would wait till the very last minute or until I demanded something, because, you know, growing up like my dad was.
She should have known somebody marching up and saying, "Mom, I demand medication, there's something wrong with me," would be a nurse.
So I always tell this to any of my patients, that how you are made does not define you. It's how you put the energy out to fix how you're feeling. So you have to be honest with yourself, and that's the first step. You know, like, I have this problem. I know I'm, you know, not getting out of bed. I know I'm not as energetic, or I know it's causing a problem with my relationship, or I know I'm super manic. I know I'm overspending.
I know I'm 300 pounds, and now I see it, and I'm going to do something about it.
Yeah, so talking to someone. People think a medication is going to help, and it's just one part of it. Like, you have to talk to somebody.
So get honest, speak up, get some help if you need it. Don't be ashamed.
Right. And now they're making more things where it's kind of accessible to everyone. So you can text to a hotline now. You can call a hotline. You can even get on an online chat for a hotline. Great. So if you're ever in a crisis, please reach out to someone.
Okay. Cool. Thank you, Miss Patty. I really appreciate it.
Thanks for having me.
Hi guys! Oh, you're so cute. We did a good interview. Look. Hi, Dookie. Oh, you're Dookie. Hi. Hi, Dookie. Hi, sweetheart. Hi, sweetheart. Okay. Oh, what a beautiful pool.
You're more than welcome to use it.
What?
You're more than welcome to use it.
I can use the pool? I was just talking about that. Part of your world.